Hey, welcome back to Wiser with Your Health. I know you all have been seeing me do a lot of things on high blood pressure, but I've yet to describe what high blood pressure is. And for many of us, we don't know what high blood pressure is. We know that it's something that exists, but we're not really for sure what it is. So I'm going to read some information about what high blood pressure really is. And by the time I get done, we'll have a pretty good understanding of it. High blood pressure is a common condition in which the long-term force of the blood against the artery walls is high enough that it may eventually cause health problems such as heart disease. So we understand that when our heart is beating, it is putting pressure up against our artery walls. Okay, blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower, meaning the narrower your arteries, the higher your blood pressure. A blood pressure reading is given in milliliters of mercury, which in parentheses would be MM, capital Hg, close parentheses. It has two numbers. Okay, so many of us, when we go to the doctor's office, we'll see them look at when they're pumping it up and the band gets tight, they're going to be looking at two numbers. The top number, which is the systolic pressure, the first or upper number measures the pressure in your arteries when your heart beats. Okay, the bottom number, which is the diastolic pressure, the second or lower number measures the pressure in your arteries between the beats. So one is measuring the pressure, and the other one, when it's beating, the other one is measuring the pressure when it's not beating. Okay? So you can have high blood pressure for years without any symptoms. That's why it's called the silent killer, from what I'm learning. Uncontrolled high blood pressure increases your risk of serious health problems, including, but it's not limited to this, heart attack and stroke. Fortunately, high blood pressure can be easily detected, and once you know you have high blood pressure, you can work with your doctors to control it. Okay, now some of the symptoms that you may have, most people with high blood pressures have no signs or symptoms whatsoever. Even if blood pressure readings reach dangerously high levels, like mine was, I think the first one they read was 175 over 110 or something like that. And I felt fine. I felt relaxed. Had no idea what was going on. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds. But these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or a life-threatening stage. All right. So, sometimes we get headaches, could be from food we eat or anything. So it's a headache sometimes can be pretty common with some people. So you can't just limit that to high blood pressure. So we have to be very careful with this high blood pressure, especially in our community, when we eat high levels of pork and things of that nature, salt, all of that is in our foods that we like to eat as a people. And I will tell you that there is a book, and it is called the Bible, that tells us what foods to eat and what foods not to eat. Now, I know that some people don't believe in that, but I'm just letting you know up front, stay away from the foods that the Bible tells us to stay away from, because it is not food for us. All right. So, like for myself, I have a surgery that's going to be here in a couple of days, actually. And I have been taking, some blood pressure medicine. Actually, I did a video on that, and I will be taking it for the next couple of days just to make sure my blood pressure level stays down. And, they won't cancel my surgery on me. But after that, I'm going to be working to find out what's causing it, and I'm going to be looking for natural things to take. So there's a video that I've been watching by a guy, and maybe one time we can talk about it, that he explains high blood pressure. He explains the chest pain. He explains angina. He explains all of that. So I'm going to be looking at that really serious, and I'll come back with some more information on that as well. So thanks for joining. This is Wiser with Your Health, and we are going through this, these little episodes because this is something that I'm dealing with, and many of our people really are dealing with. Let's be honest, most of us don't want to go to the doctor and be pronounced with high blood pressure. We don't want to. So it's something that we've got to deal with. It's easier just to leave it alone and not deal with it and not go to the doctor, not have that stigmatism of having high blood. It's easier to do that. Well, to not go and do that than it is to go and realize what's going on. So I hope this has been helpful for you. This is something that I didn't know. I kind of knew about the systolic and dystolic, but I didn't know the purpose of it. So anyway, hope this was helpful to you. You all take care, and I will be back again. Peace.